So the next session that is on our agenda is, patient's perspective. That's not right. We're going to be talking about informed consent. My name is Laura Cleveland. I am from the Columbus, Ohio area, and I am a cancer survivor. I am a layperson who has been working in the clinical trial world now for about 10 years. I am glad to say that I am here. I was diagnosed at age 36 with leukemia, and I'm glad to say that I can wear old lady glasses to read. So we have a great panel this morning for improving the informed consent process. I will introduce you to them by name, and hopefully they will introduce themselves as well when they come up to the mic. As I said, I'm Laura Cleveland. I do have some roles within the clinical trial community. I serve on the Alliance for Cancer Clinical Trials. I'm also a member of the NCI's CIRB. I've had lots of other experiences. What I thought was going to be a cookout in my backyard several years ago with other patients that had the same disease as I did turned out to be a patient-centered meeting that drew in some of the most eminent researchers in the type of cancer, and also about 100 we had 100 the first year, 100 patients come, and then about 250 2 years later. So this was my introduction to clinical trial research. On our panel, we have Mary McCabe. She's the Director of Survivorship Program at Memorial Sloan Kettering Cancer Center. We also have Terrence Albrecht, who's the Associate Center Director at Carmano Center at Wayne State University. We have Michael Pasha-Orlo, who is the Associate Professor of Medicine at Boston University, and also Jeffrey Botkin, who's the Associate Vice President for Research Integrity at the University of Utah, and chair of the Secretary's Advisory Committee on Human Research Protections. So what I hope to do in this first part is to give you an idea of what your patient looks like, or what patients look like when they walk through the door, getting ready to be, getting ready to look at an informed consent. Usually it starts with a sleepless night. So not the most rested or well-thinking people as we come in the door. And then you have breakfast with the family, which doesn't always go smoothly, and it's usually those important days when it doesn't go smoothly. And then you're just trying to get there. You know, we've had, you've got your regular traffic, and then this winter we've had your snow traffic, which slows down the process as well. This is actually a cancer center. I'm not picking on Ohio State. It just happens to be close to me and where I am seen. If it's like your cancer center or hospital, there's lots of construction going on, just another barrier to getting there. You have these towering buildings of varying sizes. You're not sure which one to be in, not sure exactly where you're going. So are you finally there? So you're signing in. You start the signing process the minute you walk through the door. So you sign in and you wait. And you know, the mental processes hopefully are starting to go a little bit more, and you start to wait and wonder and worry. There's information staring at you, which is good and bad. And then there's more information. And then just a little pinch, right? Only going to hurt for a second. And then you need to go here. And then let's sign in again. Signing more. And waiting some more. And then could you please go down the hall, make a right, and then go up 3 floors, and, you know, by that time you're already saying, can you go back to that first part where you go down the hall? It's confusing, overwhelming. You have a talk with a study nurse, and you try to make a thought, just a thought, to answer a reasonable question. And here's the study nurse saying, I'm so sorry, this is so long. It doesn't really happen, but it did in this slide. But first, we're going to need a little bone marrow, just a little pinch, right? Put in vulnerable positions, and then you wait again. And nothing like a bone marrow to wipe the smile off this person's face. So you have to ask, what does this person walk away with at the end of all this? You know, in this short time period, you've all been there, just getting to the doctor's office, or, you know, having a rough morning when there's something important going on, and are you in the best position to make really important decisions at that time? So I think what we're going to do this morning is to go through these issues and try to understand, not only from a patient's perspective, but when the rubber hits the road, how can we improve this informed consent so that it's meaningful for the patient, so they understand what's going to happen to them, and so they can make a very important decision about what they're going to do about their cancer. Okay, Mary?